Good morning. Thank you for joining us for today's webinar, Tired of Turnover? Creating a Culture of Wellbeing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending attendance certificates. A survey will be launched at the close of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenters will address them at the end of today's presentation. Today's webinar is being presented by Rob Crowe, founder and CEO, and Bree Becker, Director of Clinical and Quality, both with Matchwell. I'll now turn the webinar over to Rob and Bree.
Great, thank you, Wendy. It's great to be with you today. My name is Rob, and I am the founder and CEO of Matchwell. Some context, I spent 20 years in the staffing industry and 10 years helping run one of the nation's largest healthcare staffing companies. And I left to help organizations actually build their own staffing programs, all without an agency. So as such, we kind of live on the front lines of all those workforce trends and various solutions out there in the marketplace that we want to be talking some about today. Bree is also here with us. Bree, you want to introduce yourself?
Yeah, thank you, Rob. Hi, everyone, and thank you for taking the time to hear us today and give us this opportunity to speak. And just to give you a little bit about my background, so I'm a family nurse practitioner. I've been in healthcare for about 15 years and have worked in patient care up until I joined Matchwell several years ago, and just fell in line with our vision and the goal of trying to help hospitals. Coming from a hospital setting where we were always short-staffed, it was just really important to me to be a part of a bigger solution. And I'm also still in patient care 1 day a week. I work in cardiology at a healthcare system here in the Atlanta area. So it's good to be here today.
Excellent. And Bree's going to drive the slides for us. So let's get started. So today's webinar, we're really going to focus on 3 primary objectives. We're going to take a look at the current workforce environment. We'll review workforce data and the impact of acknowledging and then doing something to address some of the mental health challenges that we're looking at in the workplace. And then also third, we're going to touch on the importance of what we call work-life harmony within our workforces. And let's get started. So with all the headlines popping up pretty much daily, I think it's easy for us sometimes to forget that the current workforce trends were actually in play before the pandemic. As a reminder, we were about 500,000 clinicians short of where we needed to be pre-pandemic. Now that's all disciplines, all clinical settings. And now, with a little bit of pandemic hindsight in our rearview mirror, I think we're realizing that we weren't quite prepared for this pandemic. And that this gap is even wider than it was before we started. And so some estimates are actually saying we're closing in on closer to 1 million people short of where we actually need to be, again, across all disciplines and all settings. So some of those macro trends, again, that were present pre-pandemic were a shift toward more flexibility in the workforce. And then when this pandemic hit, everyone in every industry at all levels globally, I believe we're kind of forced to hit that reset button all at the same time and kind of evaluate their work-life relationship. And I think by and large, my belief is that far too many of us didn't actually like what we saw. So we as we come out of the acuteness of the pandemic, what we're seeing is that employees don't necessarily want to go back to the way things were before. Employees are no longer willing to give up that family time for somebody else's bottom line. Employees are no longer interested in fitting their life around somebody else's schedule. And the rise of the gig economy is heavily influencing where and how people want to work. So according to a recent Forbes article that's actually mentioned here on the screen, if we don't do something different, we're at risk of losing up to 75% of our healthcare workers. And Forbes believes over the next 3 years. Now, I'm also going to say that seems like a stretch to me. After all, we're starting to see some studies coming out that say this whole great resignation is more about people feeling the need to do something different, and that they're starting to realize the grass is not always greener on the other side. Matter of fact, there was an article in the New York Times just this past Sunday, I believe, kind of talking about maybe it's not the great resignation as much as the great pause and evaluation more than anything. But I do think in the current environment, there will always be somebody willing to pay more. And the reality is that our healthcare workforce is tired. They're burned out. And as you see, they're not feeling very, as you're going to see, they're not feeling very supported by their employers by and large. So some other stats, let's go to the next slide. 56% of nurses report that they have been sacrificing their mental health for you. 37% don't feel supported by you with their mental health. 41% feel that they lack your support. 72% of nurses claim to actually have access to some mental health support, but only 10% use it, which I think brings up the big question of, are we actually providing the right type of support? And then 41% are thinking about leaving the industry for good. Now, note that I intentionally said you there a couple times as the employer, because I want you to feel that this is personal. Because for many of these employees, this is personal. This is a perception issue. This is their reality that we're dealing with. And that's what we have to overcome in our efforts to put programs in place. And so, Bree, what else is some of this workforce data telling us?
Yeah, so we at Matchwell, we are always looking at data, and we thought several months ago it would be nice to survey our own nurses to get an idea within our network of what they're thinking and feeling about their current situation and their profession just as a whole. We do hear that term burnout a lot. It's everywhere. But oftentimes, we don't really know what we're talking about. So many of you have probably heard of Christina Maslock and the Burnout Inventory Survey. And when we say burnout, there's really 3 variables that we're looking at. So in our survey, we wanted to ask specific questions around those variables, one being mental and physical exhaustion, feelings of incompetence, and then detachment or just no emotional investment in the job that's being performed. And so we know that when burnout is sustained over a long period of time, so burnout is not new to the healthcare industry. We've known about it for decades. We've been studying it for decades. But I think now we're at this tipping point where we're really seeing the long-term repercussions of burnout. And we're seeing that in the mental health of our workforce. We're seeing it in the lack of physical health in our workforce. Nurses have some of the highest rates of obesity. The nurses also have some of the highest rates of cardiac disease than any other profession, next to social workers. So there is this big disconnect in what we know and what we're actually practicing. So we wanted to dive into that and see, well, what are our nurses thinking and what are they feeling? So we picked 2 questions we thought were relevant to today's discussion. So we're not going to go through the whole survey. So for today, we wanted to look at that one variable of mental and physical exhaustion. And by and large, 98% are saying that they're tired, sometimes or most of the time. We only had a very, very small percentage. I don't even know if you can see that little orange slice of the pie on the screen, but that is workers who are not feeling tired. And I will tell you, this was not just your bedside workers, this was leadership too. So to Rob's point, when we say when we talk about mental exhaustion, mental imbalance, physical exhaustion, we're speaking to you as well. Leaders, we're just as guilty of working ourselves beyond what we really should be doing. The second question we wanted to ask, so with those high levels of exhaustion, do you feel like your organizations are implementing programs to help you? So we recognize there's a gap, obviously. So 75% said no, their organization wasn't doing anything to address their mental and physical exhaustion. The good news is that, close to 26% said yes, their organization is actually doing some things. And we're going to share some of those programs with you later on. But again, I think this goes back to Rob's point of perception and their reality. So leadership might be in the room thinking to themselves, well, absolutely, we're addressing this, but it's not translating to the workforce. So how can we create programs that the nurses and the other workers that are taking care of our residents and our patients perceive to be helping their mental and physical well-being? I think it's also important that, when we talk about the why behind the what, in healthcare, we always have to look at what's at stake. And so, when your workforce isn't well, resident outcomes suffer. We all know this. And like Rob mentioned a few minutes ago, mental health strain and this work-life imbalance, this is not unique to healthcare. It's in all workforce sectors. And the pandemic really heightened it and shined a light on it. But I think what's unique about healthcare is that we have a lot at stake. So if we're going into our jobs and we're not motivated, we're not emotionally connected, we're not feeling engaged, people's lives are on the line. And so we know we have decades of research that show when your workforce is burned out, they're exhausted, they're disengaged, you have higher rates of medication errors. We have more resident falls and injuries and infections, which then translate into higher rates of expected deaths. So we have a lot at stake in healthcare, which is why, next to the airline industry, I would say we're one of the top industries that have to take this seriously, and we have to start thinking about what are these sustainable programs that we can put into place so that our workforce is better taken care of. Because when your workforce isn't well, patient outcomes suffer.
And I definitely think, with all the doomsday talk, it's easy for some of us to freeze or want to flee the situation. But we're all here today because we know that the status quo won't cut it. And so how do we actually start thinking differently to solve some of these challenges? Two things that we can do is spend time evaluating and implementing sustainable wellness programs for our employees. And we need to provide an environment that allow for a little more work-life harmony, as we mentioned previously. And so that's a little bit of what we're going to look at now. Why? Well, because employees are reporting that when they feel cared for, 69% are less likely to start searching for that new job. 71% are less likely to report feeling burned out. 5 times more likely to stand up and advocate for you as an employer. And by the way, that also means they're advocating for you when you're not always doing things right. But they believe that you're trying. They believe that they're valued, and they'll stand up for that. 3 times more likely to actually be engaged at work, and 36% more likely to report thriving overall, just generally in their life. And so I think you think about the impact of what we do as employers and how it impacts overall livelihoods. It's really dramatic. Now, Becker's recently put out a report of the top 10 things that Gen Z and millennials specifically are seeking. And this is specific to nurses that they surveyed. And 2 of the top 4 areas, as you would imagine, was mental health support and work-life balance. So again, sticking with this theme. Bree, can you share a little bit more about how we should think about this mental health support?
Yeah, so let's talk first about sustainable programs. So we're going to get into some of the nuts and bolts about what are specific programs that we have partners doing. The health system that I work in, there's a couple of programs they're doing as well. But I think first, let's look at it globally. What is the infrastructure that we have to have in place? Because the stakes are so high, even if you're just looking at it from a money standpoint, a disengaged workforce is expensive. Medication errors are expensive. Turnover is expensive. Injuries, UTIs, those infections that happen because staff is too tired to be engaged and careful, or maybe they have too many patients or residents that they're caring for. They cost a lot of money. They cost organizations tons of money. So we got to start thinking about these programs within that context. So what are sustainable programs? This is a good starting point because this is more than like a pizza party and gift cards. By the way, as a nurse, I still love pizza and I love a good Starbucks gift card. So we're not saying stop doing that, but we want true programs that you can start incorporating within the thread of your culture, so that the moment that a healthcare worker walks through the doors, this is part of working within your organization, this wellness. So I put up the 5 S's of a plan. So creating a sustainable plan. I recently heard Katie Boston Leary speak at a conference that was focused on workforce wellness. And if you're not familiar with her, she's the director of nursing programs for the American Nurses Association. She's also integral in creating Healthy Nurse, Healthy Nation program, which we'll talk about in a minute. And she created this simple concept of the 5 S's for wellness programs. So first it looks at, systemize. So we've got to have a system and a structure in place. So we have to take some time to organize it, get your key stakeholders in place, identify what resources you need, what the actual program is going to be, and then also identify how are you going to know if it's working. So have that in place first. And then when you look at sustainability, we want to make sure it's a program that can almost run itself. So yes, it will need some support, but we don't want to create extra work for an already exhausted leadership team. We're not trying to create more work for those of you who are here today. And then we want to be able to measure the success. So is it successful? So talking about, how will you measure that? How will you know if it's making a positive impact on your workforce? And then sacred. So this means it's got to be important enough that everyone from the CEO all the way down through the program buys into the program. If it's not meaningful, it won't succeed. And it has to be system-wide. It has to be part of the culture. I included a quote here from the Harvard Business Review, and this is actually old data from 2010. There's tons of research behind this, but thought it was fun to kind of take off this shelf and dust off. But for every dollar invested in wellness, there's a 6-to-1 return on that investment. So it's worth the money to invest in a sustainable, really good functioning wellness program for your workforce. One of my favorite authors, I always think about this too when I think about wellness programs, Malcolm Gladwell. Some of you have probably read or heard him speak, and he has a book that talks about, to be an expert at something, you have to have 10,000 hours of practice at it. So when you think about musicians, athletes, people who are really an expert in their field, they didn't become an expert overnight. So we have to think about that same concept with wellness. A 1-hour course, a 1-hour computer-based learning, or once a year computer-based learning that they have to do to kind of check wellness off our list, isn't going to cut it. If we want to get our industry the results we desperately need, we have to put hours and hours, and we have to put some money into these programs. So what are some of the sustainable programs that we're seeing? So here's a couple that our partners are implementing. The organization that I work for, they have a program called Code Lavender, which is an acute stress intervention for healthcare workers. So basically, you have an identified sacred space. So there's a special room that we have that is for Code Lavender. And then you have a response team. So there's a social worker, a charge nurse, and some other support people within the organization. So when a healthcare worker is experiencing acute stress, whether it's something from their personal life, maybe they had a flat tire on their way into work that day, maybe they just had a patient who passed away, any type of acute stress, we can activate this Code Lavender, and that response team comes to that nurse or nurse aide, takes them to that sacred space, and they spend about 15 minutes kind of debriefing them through what's causing the stress. So they're teaching, on-site mindfulness techniques, things to bring the stress level down in the moment so that they can go back and be engaged with their job. So that's one program that we've seen have some great success in hospitals. And you're hearing about these Code Lavender programs all over the US. It's not just specific to Atlanta. Another one is just having a quiet place, or what I call a Zen den. So maybe you don't have the extra people or the resources to do a full Code Lavender program. So a modification of that would be these sacred spaces or Zen dens. So you essentially find an area of your hospital. What I'm seeing a lot of organizations do, which this sounds bad, but I think the end result is really good, is they're finding like a storage room even. Like what's a space that we can clean out, refurbish it, paint it, a nice color, put in some nice rugs, some nice comfortable furniture, lamp lights versus the fluorescent lights, have some lavender scents. And it's a place for the healthcare workers to go and just spend maybe 10 or 15 minutes when they're experiencing stress. So there's some easy programs that you can put into place. And so if you don't have all the resources to have a full Code Lavender, there's a modified version of that. With a group of Arkansas nurses, so part of our survey, we talked specifically to about 500 nurses in Arkansas. One thing that stood out to us that we thought was really a fun wellness program was the Calm app. So for Nurses Week last year, their hospital gifted every nurse with a 1-year subscription to the Calm app. And so they're doing things within their organization around that Calm app every week, and they're measuring to see, are we going to have some positive results from this approach? So it's more than just, here's your gift, take it and run with it, but they're also tracking and measuring to see if they have some identifiable outcomes. Because we have to teach our workforce how to incorporate self-care into every aspect of their life, even when they're not working, which is why one of my favorite programs, and it's one of my favorite for several reasons, Healthy Nurses, Healthy Nation. So this is by the American Nurses Association. One thing I like about this program is it's 100% free. So it's a program already created. You don't have to pay to participate in it. The other thing is you actually don't have to be a nurse to register and participate. So by design, the program, by focusing on the nearly 4 million nurses in the US, if we can focus on the wellness of nurses, that will positively impact families, coworkers, organizations, and our residents. So it's essentially making the nation healthier. And which can be transformational for our nation. And it's something that you could participate, you could have your workforce participate in now if you wanted them to. Did not mean to skip ahead, sorry about that. If you want more information, Healthy Nurses, healthynation.org, you can access that today. It's really simple to sign up. You enter some information in, you'll actually take a health survey. So they'll ask you, your blood pressure, your weight. They'll ask you some key questions to kind of identify what you want to focus on. And then you identify your goals and then you start working towards those goals, and you have access to a dashboard, a community, and you'll do surveys throughout the year to see if you're making progress on those goals. So that's something that you could offer your organization today that's already created, and it's of no cost if you're looking for something that's inexpensive. And then when we talk about, data collection, how do we know if our program is working? Here is a simple tool that I saw at another webinar that a hospital is using to help their managers track the staff's overall wellness. So this is kind of like a half picture of the sheet of paper, but they have one for each month, for each worker, and it's their shift log. So if it was, day shift, evening shift, night shift, it would say that. And so for every shift that the staff member works, they just rate it overall. Was it an average shift, so you felt supported most of the time and wasn't, particularly stressful? Was it a stressed or bad shift? So was there a lot going on that made, that you noticed you were stressed for the majority of the time? And then was it a good shift? And so it's a great tool because it gives not only some quantitative data to look at to see, like, over time, once you implement a wellness program, we should see more and more average and good shifts and less of those stressed shifts. And so it'll give you some talking points with your staff to go back and say, like, hey, what made that shift good? And then, what gets inspected gets respected, right? So it can help you identify what you want to focus on and what behaviors you want to repeat, what activities you want to repeat that are making the most impact. And then some more success stories. These are just a couple of things from social media that I've come across recently. So the top left corner, that's Northside Hospital, a health system here in the Atlanta area, and they are cutting the ribbon on their Code Lavender room. And then the next picture is a hospital in Newark that just cut the ribbon on their Zen Den. So not a Code Lavender, but that kind of modified version of that. And you can see two of their healthcare workers in that bottom picture. You can see the comfortable couch, the lamplight, the kind of calming color of the room. So they have somewhere quiet that they can go. And we're seeing a lot of success, and it's going to be exciting over the next couple of years to see how these programs are transforming the workforce. So I'm going to turn it over to Rob now so that he can talk about the work-life harmony aspect. So we've got the wellness. Now let's talk about work-life harmony.
Great, thanks, Bree. So this is a quote directly from that Becker's Gen Z Millennial study that I referenced. Quote, "We are looking to be able to choose our own schedules and which hospitals," and you can plug in any clinical setting, "we work for. Having multiple options for how we want to work is so helpful. Being able to go the traditional route of taking a full-time role at one hospital or picking up shifts at multiple facilities to work around other commitments we might have, such as childcare or other responsibilities." In other words, they want to have options that allow for a work-life harmony, and they realize that harmony is constantly changing. Life happens, it's constantly moving, and they want to be a great employee, but they also want to find that balance so that their life is not sacrificing too much. So to clarify, I do want to make a point, and that is most employees want a full-time job. I'll even go so far as to say, actually, I think they need a full-time job because their mortgage is not flexible. But the macro trends that we were seeing, again, even before the pandemic, was this move away from that traditional full-time job for a growing segment of the population. Not everyone wants a full-time job. They want that harmony with the rest of their life. We often hear it called work-life balance. I personally chose a different phrase because I'm not sure that there is a balance anymore, to be fully transparent. I really do think the right word is harmony. And part of that word of harmony, and I think the reason it's important that we think about it this way is, we just want to feel like we have a little control. We just want to have enough flexibility to be able to take care of ourselves and our families while also being a great employee. I also think there's something about this harmony word where, it's highly personal, and it varies greatly by person. When we say work-life balance, I think a lot of times, we think of our phones and our devices and being plugged in and it's always turned on. I think that's part of it, but I think this harmony, can ebb and flow based on a lot of other variables. And again, it's highly personalized to that individual at a very specific time. So let's go to the next slide. I'll give you some examples of maybe some of those people that are not looking for your full-time jobs. Number one, moms. When we think about the healthcare workforce, the vast majority of it is female. And so when we think about this, and then we think about the greater society, and I will be the first to admit that we males have done a pretty lousy job of upholding our end of the bargain. And so we put too much burden, I think, on the women to balance, finding that being that great employee and raising a family. Well, why do they have to decide? Why can't we get more out of them as being a great employee, but also give them the flexibility to also be there for their family? We think about those clinicians that are looking to scale back. So maybe they're at the, nearing the end of their career. The average nurse is approaching, more than 25 years of experience. Is it time for them to start scaling back? The other piece, especially after the last couple of years, are those that are just burned out, or they can't just keep doing what they're doing at the same pace. And so how do we allow people to scale back without actually leaving the industry, without actually leaving us? How do we retain them? A third group are those full-time employees that are moonlighting. Guys, remember, harmony is not just about scaling back. It might be that hot water heater that is busted, or college that's getting more expensive, or other things. Like, harmony goes both ways. Sometimes it's actually picking up more work. How do we make that easy for people to do? And of course, these study after study after study of just the cultural expectations of the millennial and the Gen Zers, that many of them look to us, I'm a Gen Xer, or they look at the boomers and they're saying, I see what you sacrificed for work, and I don't want to sacrifice in that way. And so how do we create a workforce where we can actually get the most work out of them? But again, we have to meet them halfway. And then the last bucket is really, all those people that are currently working through agency, all those people that are just looking for a little bit more harmony. And I mean, what of those of us listening today, like, how many of us don't want a little more harmony? I know I could use a little bit. So, you start looking at this and you realize, well, gosh, this is the majority of people out there. And that's why this is so important for us as organizations to actually look at saying, are we doing enough to actually provide them ways to work at our organizations? So let's go to the next slide. And I think the first part is flexible work does not have to be scary. I think many of us think about how many resources and how much effort we're putting into our full-time hires, and we can't retain them, we can't get enough. So the idea of introducing something flexible can be a little intimidating. Again, most people want a full-time job. So we're not talking about replacing those looking for the full-time job with flexibility. We're really thinking about it as, how do we create a landscape to better tap into those people, the ones that we just talked about, and get more out of them, give them more flexibility, and create a workforce and an ecosystem where there's a place for all of them at our organizations. Think of it as actually accessing more, and then also a powerful retention tool, because your employees don't have to go somewhere else if you are providing them the flexibility that they're seeking. But if you don't provide it for them, somebody out there will give that to them. So think about it as not just accessing people, but also retaining the people that you have. Some of the trends that we're seeing and things that we're helping clients build, one are these per diem float pools. Float pools is not a new concept. It's been around forever, but there is definitely a resurgence of interest in, we need a float pool to be able to cover more shifts, to be able to float people from one department to another, or one building to another, et cetera. And a lot of that is actually full-time employees that maybe they're locked in, or they're committed to working at least 3 shifts a week, or some kind of continuity. So you really have this continuous a workforce, but it's how you move them around. Well, once you have that, it's a lot easier than to have those people only looking for 2 shifts a week. Or what about those people only looking for 1 a week? Again, if you've got that infrastructure, you can actually accommodate those. Another trend we're seeing, and we love this one, are these internal staffing programs. Why hire somebody through an agency when you can have your own flex work program internally? So this is not just that, those people basically working full time or some kind of continuous work being floated around. This is truly having a pool of resources that you can tap into to fill in the gaps. So maybe it's hiring your own travelers. Maybe it's, and you guys are seeing the news just like we are, like there's how many hospital systems and healthcare organizations, skilled and assisted others, are now investing in trying to build their own programs, especially after the last 2 years of how much they spent in premiums to all these agencies. Why don't we spend a fraction of that and actually access all these clinicians directly? Another example is job sharing. And when I say job sharing, hold on, you might want to sit down for this. Actually, organizations starting to share resources. So instead of us just being competitors and trying to fiercely compete and kind of steal each other's talent away constantly, what if there was an environment where we could actually share more productively? Because as we all know, there are times where some organizations are overstaffed and other organizations across the street are understaffed. How do we balance that out a little bit through sharing of resources? Now, there do have to be rules of engagement here. We can't collude on what we're paying and other things because we'll all get in a lot of trouble. But there are ways that this can work where it actually lifts the tide for everybody in a community. Because remember, there's not enough resources to go around. So chances are, if you're overstaffed and feeling good about yourself that day, your competitor down the street's probably not feeling that way. So again, how do we lift the tide for everyone? Another example, flexible hours. So this is, again, not a new concept, but we are seeing more and more organizations really think about how to optimize the resources that they do have, and then therefore provide more flexibility to their workforce. So, in the hospitals, it's those 12-hour shifts. Well, what if they were 8 hours or 6 hours or even 4 hours? Or in the skilled nursing buildings, maybe it's not just an 8-hour shift 5 days a week, but it's 6 hours, for 3 days a week, which now accommodates a lot better for those school schedules or other things. And so again, we're seeing a lot more interest and flexibility on how to actually put the puzzle together. And through technology and other things, we can actually piece together those schedules a lot more efficiently than maybe we could when we were using Excel and pen and paper to do that. And then also kind of this concept of team nursing. And so, whereas a lot of these, the first 3 are kind of talking about quantity of staff and how we piece things together, these last 2, the flexible shifts and then also this team nursing environment is really, instead of having a couple nurses on a department and, each of them having their own patients that they have to go basically work and support as, in their own silo, taking a little bit more team approach so that the weight is kind of ebbing and flowing based on what that individual needs on that day. So one nurse could, when they share the responsibilities for that pool of patients, maybe it's not all the stress on one nurse, but it's kind of shared a little more dynamically between the 2 or 3 of them. And so we're seeing a surge of, again, more team environments instead of, okay, let's divide and conquer. You take those 8 patients, I'll take these 8. So these are just some of the different work arrangements. Our goal today is not to, kind of give you every last detail on how these things work, but rather it is trying to introduce you to some things that if you're not talking about amongst your teams, maybe this is a good place to start. And so kind of moving on, Bree, one of the things we talk about a lot is as a company, what we're committed to doing as part of this conversation. And we do believe that we're all kind of in this together. And so, Bree, can you share a little bit more about, kind of next steps and what we want to do for all the attendees today?
Yeah. So, when we say that we are partners, we really mean it, and we are committed to partnering with our organizations, with all of the healthcare system to have access to more mental health resources, and then providing you access to that. So we do have a gift that we are going to provide all the live attendees for today, just to kind of, show that we really are committed to you. We want to elevate, we want to inspire, we want to rally behind our partners because you are doing great work. That's important. And so historically, as a leader, we see that working ourselves to that point of exhaustion is seen almost as a badge of honor. Healthcare is a very stoic profession where, we don't ask for help. Sometimes that's seen even as a weakness. And so many of you here probably fall into that category. So we want to help you to start focusing on your own mental health and wellness because it really does start at the top. So you have to have healthy leaders to have healthy workers. So we have 2 books that we have found are meaningful. They were actually created by healthcare professionals. So for those of you who attended today's live session, you're going to get a code that will email you, and you can pick your choice of book on us. And so we just want this to be the beginning of a pipeline of resources that we're offering to our partners. And we're in this for the long game. We want to see healthcare and we want to see the people in healthcare make this a profession where all of us flourish, where we do have work-life harmony, even though it is a hard job. And, taking care of residents and patients will probably never be easy, but how can we make it better so that those of us who are in it because we genuinely care about people, we can focus on that, but we're also caring for ourselves. So the first book, it's called Human-Centered Leadership. So it was written by 3 nurse executives in the Atlanta area, and they used years of qualitative research, and they've identified a new way for organizations in healthcare to start thinking about leadership. Because most leadership theories that are used in healthcare, we've actually kind of borrowed from the business world. And so, yeah, healthcare is a business, but it's a people business. So we have to think about it from a different approach. They took data and they found that there's really 3 styles of leadership that exist in healthcare already. And it takes those 3 styles to have a successful, balanced organization. And they also make a point that you don't have to be a formal leader to fall into that, one of those 3 categories. So, they see the bedside nurse, they see the nurse aide. They're a leader too. Everyone has someone else that's watching them. So I think back to my early days of nursing, and I remember seeing some of these characteristics in my peers. So what they have are 3, the awakener, the connector, and the upholder. And so the awakener, those are those people that you work with that are motivating, they like to mentor, they're coaching. They just naturally go into those more formal leadership roles. The connector, these are your collaborative people. They're, they can easily go between departments and they can bring people together so that we have more cohesive care. And then the upholders, they're people-oriented, others-oriented. They're emotionally aware. When the rest of the team is stressed out, they're the ones that stay strong and kind of hold everyone else up. So if you want to learn more about human-centered leadership, you can pick this book. It's a great starting point if you want to start restructuring some of the, programs within your organization, and it's all focused on caring for yourself as a leader first, which then trickles down to your direct reports and those that are on the front lines. The second book we have, which was also created by the same nurse executives, is just a daily journal that's focused on mindfulness. So if you're looking for something more tangible that you can start doing every day to improve your own wellness, there's this journal called Shifts. It's the journal for nurses by nurses, and it's focused on mindfulness and setting intentions every day. So it walks you through, here's an intention for today, and then you can come back and reflect on how you did. I use this one every day. I've been using this for about 3 weeks, and I have found it to be really impactful. So if you're like me and you need a little bit of structure and kind of a starting point, because if somebody said, set an intention, I kind of look at you and think, I don't know what you mean. And so they have a list of intentions that you can set. So I put 3 of my favorite that I have found to be really impactful. Hear the whole story instead of filling in the gaps. So I'm sure some of you are like me, where our mind likes to create stories that just are not true. And so setting an intention of hearing the whole story and not filling in those gaps. That is one way that you're taking care of yourself. You're decreasing your stress. Assuming positive intent with others. You know, if somebody does something, they say something maybe doesn't come across the right way, assume that they were not negative in their intentions. That has really, really impacted me and helped my day-to-day. And then looking for the positive in negative situations. I think that with healthcare today, there is so much focus on the negative right now that we're losing sight of the positive. We're losing sight of the positive, meaningful impact that we get the opportunity to have in just working with people at their sickest, at their most vulnerable, and sometimes at their most happy. That, you know, we need to start looking at the positive, spending some time every day looking at the positive and not being always consumed by the negative. So we'll send you codes to access one of these books at no cost to you. And we want this to just be the start of the many ways that we're giving back to our partners and the larger healthcare community. So we're at the end here. Rob, I don't know if you have any closing comments, but we would also like to just open it up for discussion and questions, or just for you to share with us what you're doing in your organizations to promote wellness, if you have that.
Great, thanks, Rob and Bree. This is great information. I really like the journal idea. I might have to get my hands on that one as well. That's really terrific. We are open we still have a couple minutes left in our time here. So if you do have any things that you are doing in your organizations that really stand out and that have worked well, we'd love to hear from you. Or if you have any questions, now would be the time that we would take those and dive into them before our time's up today. And while I have a couple minutes here before we end and before questions come in, I just want to remind everyone that we do have several more webinars coming up between now and we're planning into the summer months. So look for those. We have several great webinars, good content and interesting and timely information as usual. So look for those. We have a couple more coming up through the end of this month and then into May and June. And again, we are scheduling into the summer months. And we also have our quality symposium coming up. 10 CEUs will be offered for it starting May 4th. It'll be a virtual offering and 24-hour access at your convenience. So you don't have to be tied into a specific time to take those in. This is a quiet group today.
That's okay.
Everything really well. And
that's okay. Yeah. Well, thank you guys so much.
Come in here. It says, in my past organization, we created a position or a person who served in the role of resource coordinator and was available to all staff who needed to talk, vent, or just reach out for help, either personally or professionally.
That's interesting. There's a hospital here in the Atlanta area who had just created a similar role over the past couple of years. It's called the Chief Wellness Officer. And so that sounds like a similar role, and I know they've had a lot of success with it as well. And even focusing on, like if a manager has an employee that maybe is kind of, they sense is teetering on the edge of leaving the organization, that Chief Wellness Officer and their team can intervene and meet with that staff member and let them vent, like you said. Maybe it's finding another department within the organization that they would be happier in. But yeah, I think that's a really unique and innovative approach to focusing on retention and just giving the workers someone that they can talk to.
Yeah, Cheryl, we appreciate you sharing that information. Thank you. Anything else that anyone wants to share or questions that you might have? Again, we still have just a couple more minutes left in our time here. Otherwise, we can give you a couple minutes back in your day, which is always helpful. All right, I think we'll start wrapping up here. Again, just a reminder to stay on to complete the survey. That information is helpful to us. And today's webinar recording will be made available on the PHCA website. And be sure, again, to check out the others that we have coming up. Like I said, we have quite a full schedule of webinars and the Quality Symposium coming up within the next month. Again, I just want to thank Rob and Bree for the information today. I think it was a lot of great tips and information to take back into your communities and to engage that workforce and hopefully retain them as well. Just want to wish everybody a great remainder to your day and ask everyone to stay well.
Thank you, guys. It was really nice to speak to everyone.
Thanks, everybody. Take care.